afternoon. My name is Kristen. I'm the co-founder of RX Live, and I'm a clinical pharmacist. Thanks for joining me today. Today, I wanted to talk to you about ADHD, Attention Deficit Hyperactivity Disorder. As a mom and a pharmacist, I can certainly understand how difficult it is to determine which treatment option is best for your child. So, I'm going to start off by laying out the national guidelines, and then I'll give you my own take. In the United States, ADHD is one of the most common childhood disorders. It affects around 11% of children. Boys are 3 times more likely than girls to be diagnosed, and around 70% of children take medications for their symptoms. The age of your child will determine which treatment option is used first. If your child is 4 to 5 years old, behavior therapy is recommended first. If this is not sufficient, then medication such as methylphenidate is second line. Children 6 years of age and older are recommended to take medication and/or receive behavior therapy. The use of both in combination is preferred. The American Academy of Pediatrics recommends starting with any FDA-approved medication for the treatment of ADHD. There are 2 classes of medication, stimulants and non-stimulants, to choose from. The stimulant medications have been around for longer, have more clinical evidence supporting their use, and are the most effective in children. So they're typically used first line. The stimulant medications are further broken down into 2 types, methylphenidates and amphetamines, and either can be used first. You likely know these medications by their brand name, Adderall, Concerta, Vyvanse, or Ritalin. The most common side effects with these medications include loss of appetite, insomnia or difficulty sleeping, and dry mouth. These particular side effects occur in up to 3 out of 10 children. Additionally, anxiety and irritability occur in up to 1 out of 10 children. If your child cannot tolerate these side effects, it's reasonable to switch to a non-stimulant medication. These medications include options like Strattera or Clonidine. They also have side effects. However, they don't typically follow the same side effect profile as the stimulants, so it's reasonable to switch. Now, switching gears a little, as a mom and as a pharmacist, here's my personal take on the diagnosis and treatment of ADHD. Medicating a child for lack of attention will technically work to increase attention in anyone, with or without an underlying diagnosis of ADHD. This is why Adderall is so popular among college students. It helps them to focus, pull an all-nighter, and party harder. It works. It's also easier to have a prescription written and filled, rather than schedule, plan, and attend behavior therapy counseling. Which leads me to my next commentary. ADHD may be misdiagnosed in children who actually suffer from anxiety, have a learning disability like dyslexia, or come from a stressful home environment. This may be why non-stimulant medications don't seem to work as well as the stimulant medications, because these medications will not work if a patient doesn't actually have ADHD. If your child is currently taking a medication and doesn't seem to be improving, this could be because they've been misdiagnosed. This is why I recommend starting with behavioral therapy counseling first. The counselor will be able to further evaluate your child's symptoms and provide help to your child to develop valuable coping strategies to stay focused, which they can then use going forward. Well, that's it for today. I hope you found this helpful. Thank you so much for joining us. For more information on this and other topics, check us out at rxlive.com and follow us on our blog. Thanks.